Welcome back everyone. So our today's topic is shock. What is shock? Shock is a critical condition brought on by sudden drop in blood flow through the body. So I have written the definition of the shock, that is widespread hyperperfusion of tissues due to greater than or less than 90 in blood pressure, less than or greater than 90 millimeter of mercury. So let's write the types of shocks plus causes of shocks. So the mnemonic here is S N A C H E D and O. So I'm going to write the types and causes together. Okay. So the first one is septic shock. It's N, not M. The second one is neurogenic shock. The third one is anaphylactic shock. The fourth one is cardiogenic shock. The fifth one is hypovolemic shock. Now I'm going to write the causes. The first one is endocrinal crisis. The second one is drugs. There are certain drugs that causes shock. And then there is obstructive causes. So these are the types and these are the causes. So all these conditions they causes lactic acidosis, they causes ischemic ATN, and it causes renal failure. So now let's write the causes of septic shock and neurogenic shock and anaphylactic and cardiogenic and hypovolemic shock. Okay. Causes of septic shock. So what are the causes of septic shock? Let's write. There are two types of bacteria that causes septic shock. That is gram-negative bacteria and gram-positive bacteria. Gram-negative bacteria, they causes endotoxic shock. And gram-positive bacteria such as streptococcus, they causes toxic shock. Toxic shock syndrome, toxin 1, TSST 1. Okay, so let's draw the structure of gram-negative bacteria. Here is the outer membrane. And this outer membrane is only present in gram-negative bacteria. Okay. So this outer membrane, it's lipopolysaccharide. or it's also known as endotoxin. This endotoxin, it's responsible for septic shock. Therefore, septic shock is also known as endotoxic shock. And this type of shock, it can't be found in gram-positive bacteria because it's only present in gram-negative bacteria, and that's because of this lipopolysaccharide membrane. So now let's write the causes of neurogenic shock. There are two causes. When the CVA center is effective, that is vasomotor center, and when the spinal cord is effective. Means there is a surgery or injury or epidural anesthesia. It causes neurogenic shock. Okay, so let's write the causes of anaphylactic shock. There are three antigens that causes the anaphylactic shock. There is IV penicillin, okay, snake venom, and bee sting. All of these are harmless antigen. Now let's write the causes of cardiogenic shock. There's endocardial reason behind it, myocardial, and pericardial. It can be because of myocarditis, severe MI, and endocardial cause can be because of acute valvular lesion, and pericardial cause can be because of pericardial tamponade. Or massive pericardial effusion along with massive pericardial effusion along with systolic blood pressure less than 90. So let's write the causes of hypovolemic shock. The main cause of this is because of hypovolemia. and it can be because of these three reasons. Number one is acute severe blood loss. Number two is severe persisting vomiting or diarrhea. Number third is profuse sweating. It can cause hypovolemic shock or severe burn. In severe blood loss greater than 1.25 liter, it can cause 1.25 liter blood loss can cause hypovolemic shock, severe persisting vomiting or diarrhea, it can cause hypovolemic shock, severe profuse sweating, it can cause hypovolemic shock, and severe burn, it can cause hypovolemic shock. Now let's write about some of the causes of shock. And there is endocrinal crisis in case of Addisonian crisis. And the drugs that can induce shock in your body is beta blockers, diuretics. There are some of the diuretics that can induce shock, and anesthetics. Now, obstructive causes that can induce shock in the body, that is massive pulmonary embolism. So we have discussed here about the definition of shock, type of shock, and causes of shock, and what causes these shocks, and in which crisis or drugs, or what are the causes behind this shock. So see you in next video. Bye bye.